Hi, I'm Marisa Gulizia, physical therapist at Athletes Training Center, and today we're going to talk about how female athletes are a little bit more prone to ACL, or the anterior cruciate ligament injury. Now, here's a fun fact for you. In 1971, it was recorded that there was over 3.7 million males that were athletes versus the only 300,000 female athletes. In 2001, another record came out that said that there was only 1 million more male athletes opposed to the 2.68 million female athletes. So overall, the female athletic population has grown tremendously in the last 40 years. So when we talk about how there's maybe more female athletic knee injuries, we have to think about that the population of female athletes have grown just in general. So today we're going to talk about, again, how maybe there's some anatomical differences between males and females, and some also just biomechanical differences between males and females, and that's the reasons to why maybe the females are a little bit more prone to that injury. The female hips are a little bit wider, the pelvic is a little bit wider in females than males, causing what the medical field would call a Q angle. So that's the angle between the hips and the knees. That becomes a little bit more steeper when your pelvis is a little bit more wider. If we go down here, which that Q angle, that steeper Q angle causes the knee to be a little bit what we would call more valgus, or the knee coming in a little bit more. There's three components to an ACL injury usually. It's the flexion of the knee or the bending of the knee, that valgus angle when the knee kind of comes in due to contact or just mechanically, and then just a rotational component. So we'll show you that later on, but those three components is a typical cause of the ACL injury. Another reason to why some people in the medical field think that women are more susceptible to that injury is that the ACL actually sits in a femoral notch, and that notch in females is a little bit more narrow than the males. Some other reasons to why females are just more flexible than males, so having more flexibility and not more stability also causes possibility of that injury. Also, females once a month have to go through that menstrual cycle, causing more laxity in their ligaments. So there was a study done that showed that there was about 150% more laxity in tibial, when the tibia comes forward, which is the job of the ACL, is to allow that not to happen. So with that said, again, during that time of the month, women tend to be a little bit more injury prone than any of the other time of the month. Later on we'll show you some difference to why mechanically females might be a little bit more prone to injury than males as well, causing with muscle recruitment and how the muscles turn on and turn off, and how females use certain muscles more than others.